Dr. Ferrer had a warning today as well. If cases continue to surge, we could see record numbers by the end of December.
Yeah, those numbers could hit well over 20,000 new cases a day in LA County alone.
And here to tell us more about the Omicron danger is Dr. Michael Daignault with Providence St. Joseph Medical Center in Burbank. Doctor, thank you so much for the time.
Thank you for having me again.
All right, so first question, how does testing then identify the Omicron variant against other mutations, other variants?
Yeah, great question. So when you have a positive PCR test, so not a rapid test, but a certain number of those positive PCR tests are sent to a lab where they do genetic sequencing, which usually takes a couple of days. And so what researchers figured out earlier with the Omicron was that looking at 3 target genes in sequenced positive tests, we noticed that there was an S gene drop-off that was specific to the Omicron variant, for example, that Delta didn't have. And so that was kind of an indirect way for us to quickly identify which of the tests were sent were Omicron. But as we've seen in the country, I mean, 90% of the cases in New York are Omicron. Nationally, it's probably 75% or higher. I mean, within a week, I expect that to be 100%. So, I mean, at this point, like, we know that any new infection that you've had or you've been diagnosed in the last week or going forward is extremely likely to be Omicron.
But doctor, how concerned are you that hospitals will be overwhelmed as these cases skyrocket in the coming days? And what's being done to prepare for that?
Yeah, so a couple of points. I mean, I always look to what happened in South Africa and Europe so far, because that is basically a preview for what happens here. And so we've seen a huge drop off in cases already in South Africa, just as steep as the decline as they had an incline. And what we're seeing in Denmark and the United Kingdom is, even though they have a large number of cases, there's been a decoupling, meaning that the case numbers go up, but the hospitalizations and the deaths, you know, they go up slightly, but they're more or less flat. And so I expect the same here. And at the same time, we're just trying to do the best we can to be prepared. I was glad to see the governor announce yesterday that boosters are going to be required for all healthcare workers. But I think at the hospital level, we need to make changes to our protocol for hospital healthcare workers that test positive that are fully vaccinated. I don't think I think the 10-day isolation is outdated. I think that, you know, we know that vaccinated people that get a breakthrough infection are infectious for a less period of time. They're less likely to spread it. And so I think that if they feel better and they're able to do a rapid test that shows they're negative, they can come back to work much quicker than that 10 days. And I think that would help us prepare in case we do have a surge.
And you said it right there, get vaccinated, you know, especially as we are dealing with the Omicron variant. And also the booster, get your booster shot right now. What other things, and doctor, can people just do to stay safe on top of that?
Yeah, I think it's very important to try to get some rapid tests. I mean, the president announced this week we're going to have, 500 million more tests available, and I think you should try to get them at your stores or order them online. And, I think vaccinated people should still go about their holiday plans, their Christmas and New Year's plan. Unvaccinated people have a lot to be worried about. I mean, you still have the Delta variant that's causing some cases, and now you have a dual threat with Omicron. So, but I think, vaccinated people can do their usual things, what they're planning to do, and do daily testing, try to have ventilation, try to have windows open, try to have gatherings outside if you live in an area where that's possible.
All right, Dr. Daignault, thank you so much for your time and all of that information.
My pleasure. Good night.